Um, so we will start. We're starting immediately. Other people are going to be joining us. We have quite a number of people who have registered to participate in this program for today, and I'm so excited about the people that will be speaking. You know, under this program as well. I'm equally excited at the array of the speakers that we'll be having. And so today, we'll be having one speaker speaking today, and I'm excited about him, about his profile, and what he's been able to do within the Black community. Okay, so a whole lot is going on. A whole lot has happened, but we are so hopeful about the things that are going to happen in the days to come. We're excited about the things that will happen in the days to come. So some people are scared, but we are not scared because when you have a background knowledge about certain things, you kind of feel relaxed no matter what is happening. And so that is our excitement actually. And so with this, we kick off this Black History Natural Health and Healing event for 2022. Like I said, is the first one we'll be having, and then I know it's not going to be the last one. So we hope to be doing this, and then we hope to get a lot better at these things in the days and the years to come. All right, so I'm going to start up this evening presenting the statistics before us, and after I have done this, this is like the opening address or the opening session for this event. So after I have done this, I'm going to yield the floor for the speaker for today, who is the director of the AFIA Online Institute. Okay, so I will introduce him after my session, which is going to start, just right now. Okay. I want to share my screen with us so that we can create a kind of a perspective to why we are doing what we're doing, especially this year. So what are the statistics that we are faced with? And then we want to look at the probable solutions to what we are faced with as a community and as a people. A lot of things I've said, if you've been following me, for those who've been following the programs of Nutraceutical-led Solutions, I'd lamented seriously about the challenges that we are faced with as a people. Okay, I've had some of my clients who had to approach me to talk to me about certain conditions that they've been diagnosed with, and by the time we sit with them and go through the situation, I've had to tell them to go for a second opinion. And by the time they go for a second opinion, we discover that they were wrongly diagnosed. And this has happened a whole lot of times. Sometimes back in 2018, yeah, I had a client who had dementia, and this elderly woman, PhD holder, a school administrator, an educator, had dementia. And then if you know what dementia is and what it turns people to. But every time she's going for a doctor's appointment, this woman would literally beg me to accompany her for a doctor's appointment. Most times I would wonder what exactly is going on. Then I began to pay attention to the medications and the dosage and the effect on her health. As a matter of fact, there are some that they give to her that once she takes them, she would be knocked out completely. And then I decided to accompany her just to grant her request. And I'm glad I did, because the woman passed last year. Yeah, either last year or 2020. I can't remember exactly when she passed now. So I'm so glad that I did that for her. And then I accompanied her, and I saw the entire interaction. I saw the way she was handled by the doctor. I saw the way the doctor responded to her. It was extremely inhuman. That is just the word, for one of a better word. She was treated like she's not human. I can't even imagine a child being to be treated that way. Talk less of, an elderly person who probably, who just, is ill at the time, who was ill at the time, and that was the way she was treated. And then I could see the reason she dreaded going for the doctor's appointment. Okay, and I won't lie to you, that was just one of several cases I've witnessed here in North America, where I've had people. There was a client of mine that I had who was diagnosed with cancer, and then he was carrying that diagnosis abroad and believing that, well, let's prepare for the worst. Um, I mean, yeah, the person came in contact with me, and then we had to go for a second opinion, which I was like, well, I look at all your symptoms, I look at everything you're going through. I still cannot, I'm not so certain, I'm not too convinced with this diagnosis. Can you please consult somebody else? Can you talk to another practitioner? And thankfully, this person actually did what I said, and that changed the entire story for this person. And by the time the person checked, a second opinion confirmed this person, was not having cancer. It was just prostate enlargement, not prostate cancer. And I can only imagine what this fellow had gone through, himself, his family. And it's the same story. We can talk about this story of health, the disparity, this inequity that comes up in times of healthcare, which is experienced by most people of color across the globe. It's not just limited here to Canada. Same thing happens in the UK. I have friends in the UK who complain about the same thing. And one of the few things I want to advise people, sometimes when I want to give them the advice, is that when you go to an hospital, as much as you can, you need to try to get a doctor who kind of understand your skin color, even if the person is not of the same skin color, same race with you. Try as much as possible to do this. But in my own thinking, I began to say to myself and think within myself, how many people have been sent to their early grave just because how do I put it right now? Because of their skin color, because somebody would not take time to listen to them, or somebody would not take time to listen to their conditions before making diagnoses or before making recommendations. Only God knows how many. And that is so that can be so devastating. And I can tell you a whole lot, many people are going through this. Many people are going through this. Okay. And so what can we do as a community? That is the reason we are gathered, and then that is why we are doing this, because inequity is not new. It's been going on. We all can tell the stories. Some people can tell the stories more than some of us who grew up in Africa and had to come work, and then we migrated from Africa down here. Some people were born into this, and they've gone through decades of this. They've lived this all their lives. This is their reality. They don't even know a different world beside this. For some of us who grew up in Africa, I don't even know, I can't say which is worse actually, because for some of us who grew up in Africa, we understood what it is to grow up in a system where everybody looks like you are not different, you're not treated differently, and then everybody listens to you. It's a different ballgame for us now to come into a system and we see this kind of thing happening. But some people they've not even seen any difference. Like, this is all they've lived all their life. So we see this in everything. We see it in almost every system. Judicial system, the police system, we see it in the financial system, we see it almost in every sector. And the the worst of it is what COVID pushed up, which is the experience of this inequity seen in the health sector, where we see this disproportionate access to healthcare, and then a whole lot happened. So the statistics are there. But one thing I must say is this: for people who live, there are so many cities all over the world. A lot of people have to battle with this in their own way, one way or the other. But what I did observe is that the city of Toronto did a good job to the best of their ability. They understood the problem. As a matter of fact, one of the speakers that should be speaking is a man called Dr. Akwati Aketu. Akwati Ketu, that's his name, I believe. He is the chair of the science science team put together by the mayor of Toronto, just to look at the sciences and see how they can balance this issue and make sure that people of color, not just blacks, Latinos, everybody can actually get the right access which is required. Okay, so he did a great job. I mean, on this, and quite some other people. There are some other people of color that on that panel. So they did work together, and they came up with this. So they were able to nip this in the bud, and they kind of changed the statistics. And I'm going to show you that statistics for the city of Toronto. My hope and expectation is that other cities of the world would emulate or learn a thing or two from what Toronto City has done. That is number one. Number two is that this should not just be something done for COVID-19, but it should be extended to other areas as well of the Black life, of the experience of Black people all over the world. So the Black Lives Matter movement, for me, I've always said a whole lot is involved, and we need to start doing much more than we've been doing, than we're doing. All right. So when we protest, we are reacting. We are being reactionary, and then the protest will die down. Most of the time, the issues are not addressed. The people that we are dealing with, so to say, the system we are dealing with is an intentional system. And so for us to be able to navigate and come out and make our voices heard, we need to also be intentional. Intentionality is not a dash, it is a marathon. So it is not something people do in a day. It's something that's going to take us a whole lot of time to do. And so I do hope that this is the beginning for me and for us at Intracyclical Solutions. This is the start for us. And we are going to be very intentional about how we go about this, because I don't want to be among the people, the population that will just be shouting and be reactionary every time a Black person is killed, every time a Black person is denied access to healthcare, every time the statistics is tilted against a person of color. I don't want to start in that position where I'm only waiting for it to happen before I begin to shout, and then we wear some jerseys, we go out on the streets, we march, we shout, we scream Black Lives Matter. At the end of the day, nothing is done. They tell us something will be done, and then nothing is done, unfortunately, until the next victim, is taken down. It will amaze you that you look at the case of George Floyd, between Ahmed, the other guy that was killed before George Floyd, it was a span of about 24 months that all of these killings took place, and they were all happening in succession in different cities and different parts of the United States of America. And you would wonder, what is happening to humanity? What has happened to us? And thank God for the judicial system. Again, you can see where people who are proactive comes into play. Now, imagine there were no Black lawyers. Imagine there were no Black civil rights activists who would come up to fight, to come up and speak. Imagine we were just looking for lawyers. Imagine we are just sending our kids to school to go study law in 2021 or 2020 when George Floyd was murdered. When are they going to finish school? The case will have been decided. Things will have gone over our heads. And the same thing we need to do also in the case of our health and every other thing. There must be this aspect of intentionality. We have to be intentional about the things that we'll be doing for ourselves and for our community. And so what is the statistic saying? Okay, think about this. For me, this is a food for thought. COVID-19 affected everyone. A group of people were unable to receive care and welfare because of their race, their income, their housing, their education, and their occupation. Imagine that. COVID-19 affected everybody, but a group of people were unable to receive care and welfare because of their race, because of their income, because of their education, because of their occupation. And you would wonder, who are actually the people behind the administration of healthcare? You understand what I'm saying? Because we knew that this was a global issue. There is no way out for anyone if anybody is left behind. All of us have to be carried along. Yet some people were still not carried along, and so it's a food for thought. It's something for us to think about and then to really act on. And why is COVID-19 different? Of course, it is different because it's not like influenza. I've had people who have said COVID-19 is like influenza. Once you get the shots, it's going to go and all of that. No, it is not like influenza in that way. In that respect, influenza is not a pandemic, right? But this is a pandemic. The spread, because of the spread, and because of its effect, how it spread, and how it affects individuals. So we could not call it like the influenza. So it's not like the seasonal influenza. That is not a pandemic. There are some other things that people in our community also believed. At the beginning and the onset of this virus, some people in our community believed that it wouldn't touch or kill Black people. That rumor went very far, and it was spread abroad. By who? We don't know. And alas, when the death rate started coming in, Black people were dying in serious numbers across the United States of America. And we will tell you why. And again, like I said earlier on, some things are responsible. Why is the statistics not in favor of our community as people of color? Okay, we will talk about that as well. Okay, now let's look at this. July 16, 2020. July 16, 2020, the city of Toronto, this was their reality. In the city of Toronto, 9% of the population are Black, but 21% of cases of COVID-19 reported were in Black people. Black people only make up 9% of the population, but we were responsible for 21% of the cases of COVID-19 reported. And this is the case across several developed nations of the world. In the UK, in the US, in fact, in the US, it was worse in it is worse in the US. I'm just using Toronto as our case study. We got all of this information from them. You will see it there as a source. All right. And then I do believe things changed. How they achieved this, what they did, was something I would have loved Dr. Akweti to kind of be here to talk about tonight, but he's not here. I saw some of his videos that they put up on YouTube because they had to embark on some aggressive education, aggressive engagement for our community. And I also believe that on the part of the government, they had to adjust a few things. What they did, I do not know, like I said, I don't want to claim I know, and I don't want to stand or hold brief for them. Something happened after 1 year. Look at the statistics by September 30, 2021. The population of Black people in Toronto still remains 9%, but they are only responsible for 14% of the cases of COVID-19. So there was a 7% drop between June 2020 and September 2021. What did they do differently? That is something that we would have loved to hear from them. But one thing I know they did was that there was a massive engagement. And when I mean massive engagement, I talked about educating the people, and that I think was probably the only thing that was done, and then that also changed a whole lot of things. Maybe the second thing they also did was to make the access to healthcare a lot more accessible to people of color. And now, because there are 5 things that could be responsible, and I will deal with those 4 things that could be responsible for this inequity when it comes to healthcare access. I'll deal with those 5 things real quick. Number 1, discrimination. Racial profiling exists in systems. I mentioned this earlier, and the health system is also not left behind. I talked about, the way, in fact, I've had cases of doctors who look at you because of your skin color, and they look at you like you are not human, like your blood is black and it's different from, it's not red like theirs is red. And so when they see you, they just want to get rid of you and move to the next person. And so you don't get the right care. Sometimes profiling comes into place. Sometimes it's a deep-seated hatred. I don't even understand how you will be a doctor after taking an oath, for your profession, to uphold and to care and sustain human life to the best of your ability. Then you will look at somebody walk into your office, and you won't be able to do what you are paid to do, what you have been trained to do, because of the skin color of that individual. And yet you will struggle and do everything to save your pet, to save your dog, to save your other animals, yet you can't care for a fellow human. The hypocrisy is just so loud. And so that is one problem that happens. Number 2, access to healthcare, which I talked about earlier. Issues such as lack of insurance, transportation, childcare, and cultural differences between patients and providers, as well as language barriers. I've seen people who have issues with my accent. They will be like, "What did you say?" And I look at it as very funny, because I'm from Africa. If I can listen to you and understand what you're saying, and you can't understand what I'm saying, it shows you are lazy. That's the way I see it. Because I learn my language, I know my language. For most of these people, they only speak one language. I speak more than one language. It speaks of my intelligence. It speaks of my intelligence. And so I love when you want to consider somebody who is speaking your native language as a second language, and you want to perceive him as not smart. I wonder who is smart. Okay? And so these are issues. All right? I would expect that there should be tolerance, patience. Okay, somebody walks into my office for consultation, and the person has an accent I don't understand. We all have accent anyway, no matter what part of the world you come from. Even in England, where English is where English came from, you have Welsh, you have the Irish. They have their accent. Their kind of English is different. And then the Americans speak a different kind of English. It's very funny. I can't talk about how funny it is. So there is nobody who doesn't have an accent. So I don't even care whether you like it or not. If you're going to listen to me, you will listen. That's just the point. Okay. So that said, but the point is that you should be patient enough. I will be patient enough to listen, because when you are patient enough, you would listen. And not only would you listen, you will understand what the other person is saying. I have friends who are from Jamaica, and they speak the Patois, which is the Jamaican language, which is very rough. So you need to listen very well. And I discovered that I find the language sexy, because when they speak, it's like they are singing, So I really want to listen to them. So when they are speaking the language, I find that I would understand if I'm patient enough, and they are not in the haste as well. Sometimes they rush them. So when they rush over it, you could be lost. But when they are patient, you will listen and you will grab it. I would expect somebody who is providing care to be patient with the sick person and listen to what the person is saying and understand the fellow. Now, these are the problems, because there is a break in communication. Diagnosis is not even there. The patient don't even want to go back, because they feel like, what is the essence of my going back when I'm not heard, or when I'm not understood? Then the issue of housing also came up. Housing is a serious one, because it is discovered that people in the Black community live in crowded areas where isolation becomes very impossible. I know not all of us are in that category, but there are many of our people who are in that category where isolation, even when they are sick, it becomes impossible to be isolated. So once an individual is infected, everybody around that fellow is infected. So it's a different case where you have people who live in a 3-bedroom townhouse. When somebody is infected, it can be told to go stay in the basement, and then you quarantine that person in the basement. But for people who live, for example, you have people who live in a 2-bedroom flat, apartments, so to speak, there is no place to go. They share the same bathroom, the same kitchen, the same living room. Even if the person is going to stay in his room, he will want to use the bathroom. So there is no chance of isolation. So that was a problem. Okay. Then the last one is the disparity in income, in education, and the wealth gaps. Okay. And overall, it's a very serious case that we need to be intentional about as we build legacy, as we build generational wealth for ourselves and for kids coming after us. What I've discovered is this: a whole lot of us are afraid to take opportunities and take risks. Okay, and there is no crime in that, right? I also have, I mean, we differ from each other in our appetite for risk. Okay, but if we are afraid and we keep getting afraid, there is no way we are going to go out there and do what we should do. Okay, this program, when it was going to start, I reached out. I reached out to everybody that I know should be here for the program. In my mind, I just knew that the worst they can say is no, and they won't turn up. I won't mention names of some people here because it could affect their political career. But we reached out to them, and it would have been nice for them to be here. And because they won't be here, there are part of the discussion that we will not engage in. Because my belief is that there should be a way where we should engage policymakers and people who are in government so they can know how to handle these things better. Yeah, they are doing their part, but they must listen to the other side of the debate so that they can actually render the kind of help that is necessary. So how do we get out of this? Quickly, there's a three-part plan. Part one is to keep engaging policymakers. Government we have to make our voices heard. Number two is that we should keep educating, encourage, and we should keep engaging our community. And number three, we have to be intentional, especially with our younger ones. If you are in Canada, you're in Toronto, you've been on CP24, it's like you are watching the news in the United States of America, where every crime that is reported on a daily basis, 80% of the crime reported is by Black young people. As a matter of fact, since this year began, 2 cases of young Black kids below the age of 15 has been mentioned in the cases of murder. And you wonder what exactly is. Just today, another young Black boy, about 16, 17, stabbed a bus driver. And it's all over the news. And I'm wondering, what exactly are these kids going to do with their lives? They want to get criminal records, and they want to, we need to be intentional and then pour into these young people, because not just pour into them, we want to point them to the right areas. Now, not just go to school to read, to study anything, because that's what they've been told to do. You can go ahead and study anything. But when it comes to sports in the United States, they don't tell them to go and do anything. They force them towards football. They force them towards basketball. But when it comes to their career, no, leave them, let them do anything. And they end up doing nothing. And this cannot continue. We need more of our people in medicine. We need more of our people in law, in engineering, IT. We need more of our young ones taking up these opportunities. It is only then we can hold the future and change this narrative. Thank you very much. That is where I'm going to stop for tonight. The next speaker is ready. Then we're going to have him on right away. I'm talking about no other person than Brother Dewitt Lee. I hope I pronounced that name correctly. He's the director of the Afia Online Institute. I'd witnessed one of his events where he spoke, and can testify to the fact that he's truly African. One of the things that attracted me to him is his spirit. This man has gotten the kind of the African spirit, because the African spirit is the spirit of, it's not about what is in need for me. The first thinking is, okay, how does it benefit everybody? So let's go and get it done. That is the African spirit. That is the way we grew up, and that is the only way we know, you know. And so it's so exciting to have him here tonight, and then he will be speaking about Afia, how it has impacted people in the pandemic. Now, let me say this to him. Afia is a word that means wellness. It means being well, and then being well it's actually a Swahili word. I think I'm correct. Yes, it is. Okay, so in Yoruba, Yoruba is spoken by a lot of people in Western Africa and Cuba, in Brazil. The word alafia means peace and being well, which means the same thing. Alafia and afia, they're the same. Some of the words, they have some etymology that they sound alike somehow. I don't know how they come about them, but when I had afia, I was like, oh, alafia, afia. So I want to check the meaning, and then it was what it meant. So one more time, ladies and gentlemen, let us welcome Brother Dewitt Lee, and then he's going to take the microphone right away. So over to you, sir.
Well, thank you very much for that very thoughtful and considerate introduction. It is a true honor to be here. Congratulations on making this happen. I know it has been a long road to get here, but I want to congratulate you for your persistence, for your diligence, and for your commitment to making sure that there is a voice heard for the most important issue, health. We know health, without health, nothing else matters. And for a very long time, we have been overworked. We have been very complacent and suppressive to our health needs, especially the mental health capacity. And so we have buried all of our real concerns and things that need to be addressed and things that can be taken care of before it gets too out of hand. So what you mentioned the word reactive in the earlier part of this discussion, and reactive is also, it's not just in the civil rights movement,
True.
But it's also in healthcare.
True.
And so when you go to the doctor and they tell you have colon cancer, now you're being reactive.
Very true.
Now you're being reactive, and now you're trying to find a way to kill it, where you could have prevented it by taking just routine tests, right? So it's very important that we take a very proactive stance to our health, and and health has multiple points of reference, but when you said the Yoruba word means peace. And I think that peace comes from, knowing that you are well, and that you have a path up towards prosperity, health prosperity.
Sure.
And I think that's what we all want. If you have a path to health prosperity, then you can feel confident that you're at least at peace, knowing that you've done what you could. We know health finds a way. The elements find a way into our homes, into our lives, into our bodies, whether you're the most healthiest or not. But if you are on a path to health prosperity, at least you can know you are doing everything you can to be reactive and ensure that we live every day that God intends for us to live. So I want to just thank you, like I said, for that intro. That the beginning of this seminar truly made me think deep and hard about all of the issues that burden our people. And this is why we decided to dedicate a day to health, because there are many things that we need to focus on, but health is an area that has so much room for growth, because by now we should have our own hospitals. By now we should at least have our own ambulance service that sits right there in our communities. So when these guns, this violence takes place, right, that there's EMS in the neighborhood, right? We know our neighborhoods are war zones, right? We know that, and we need to be reactive. We stop being reactive and being proactive and say, listen, we know our community is troubled, and we know that people die here that shouldn't die. And so, and sometimes it's just a matter of time. Sometimes it's a matter of minutes. And then when the care does get there, who is the ones taking care of us? I just went to the doctors a few days ago, and you know what? It's very stressful. It's very stressful, and there's a lot of room for advocacy work. So I am proud to be on this journey with you, my brother.
Thank you.
I wanted to thank you for bringing this to Toronto and ensuring that we are able to galvanize and support, and because there's so many great people in Toronto doing incredible work in this space, whether it's sickle cell, whether it's HIV and AIDS, and even on the COVID front. So many great organizations, and it's a very important city to set as a standard for cities around the world. And so I thank you for recognizing Toronto for all that it is and does. So Day of Afia came from truly me operating as the chairman of the Canadian Kwanzaa Association. And I asked myself, what are we going to do different this year? And every year I ask myself, what are we going to do different? Right? How do we push the envelope? How do we step outside of our comfort zones? And how do we continue to change the narrative? And so, deep in prayer, deep in thought, I said, I saw the word Afia, health. And it says, listen, and I go to these Kwanzaa events. And you know what? And I know that health is sometimes a very small portion of it. And I know that it's something that when we gather our people together, it's very important that we talk about the very important things.
True.
We cannot take these gatherings lightly. There's too many emergencies in our community for us to have a casual gathering.
True.
And so it's important so I looked at this gathering, this year, of course, a virtual gathering of our community, of our village. And I thought, what's the most important message that we can push forward? And I saw this health. So what we did was we designated the day after Kwanzaa, okay, as the day of Afia. So you got your 7 days of Kwanzaa, and then on the 8th, which was January 2nd, was dedicated to health. And we had that all-day health conference and seminar. And we gave people an example of what this online world that we're looking to create is going to look like. It's an online world filled of holistic practitioners and trainers and nutritionists and meditation specialists for all ages. And that's the one thing that we have to understand, that we need to make sure our entire household is healthy.
Sure.
And not every single prescription works for every single ailment. And when you got youth that are 16 years old and you got youth that are 8 years old, they have different requirements. They have different needs.
Sure.
And we need to focus on the health of our home. So during this Day of Afia online summit we had experts in our field that focused just on introducing the youth to meditation, right? Because as you said, the violence that's taking place in our community, it's because there are anger management techniques missing, right? And so many other things. So we made sure that the entire family was represented as we put forth this vision of what this online, Afrocentric online world of wellness looks like. So we're very excited about this moment, because what you've done for us, sir, is you've given us a global platform to launch a global solution. Okay. And so I want to thank you for this invitation to join you today so that I can share with your viewers the first ever to see the app. Okay. So I don't know how many apps like this exist, but I feel like we are in very rare air, and this is a game changer.
Right.
So can I share my screen?
Right. Go ahead. Okay. Sorry.
You're on mute, so I'm not even.
All right. Yeah. Go ahead. You should be able to share your screen.
All right. Let's see here. Well, I'm just waiting for it. No, it says you disabled it. So.
Disabled it. Let's see. Okay. All right. Now you can share it now.
All right. Outstanding.
Okay.
So here we are, ladies and gentlemen. This is the App Store. Let's move this around. This is the Google App Store.
Okay.
As everyone can see, the Google App Store.
All right.
And there it is, everyone. This is not Photoshop. This is live right now. And this is just 24 hours live.
Oh, wow.
So the timing of this moment couldn't be better. So this 24 hours live, and you are getting the first look at our app on the Google Play Store. So we of course have the Apple app coming out, but this is our beta version, and we wanted to just work with in this format here,
Okay.
and grow it, okay, and just grow it. So as you see, the AFIA Online Institute, there's our logo, and as you can see, you mentioned me being deeply connected with my African roots.
You're right.
And you see Mama Africa right there for all to see. And that pyramid is there connecting those A's. That's very symbolic as well, because there's food charts and there's all kind of different things about pyramids. And pyramids first start with a foundation. And so this is one of the key things that we want to talk about. And we believe fitness is a foundation, right? We believe fitness is a foundation, and this is why we use that pyramid there. So I'll take you through it. Now, what we're looking to do is we're looking to help raise some funds, and I want you to help me. Now, what part of Africa are you in again?
I'm in Toronto.
Yes. No. What you were mentioning parts of Africa.
Okay, West Africa, Yoruba.
Okay. Very
okay.
So I want your help.
Okay.
Because this is a global platform, like I said, and what we want to do is we want to help support some charities back home in Africa.
Wow. Awesome.
So I want to talk to you about identifying a place that we can donate funds to, because for the month of February, every person that downloads this app, we are going to make a financial contribution to that charity. So that's something you and I are going to talk about.
Okay.
And we're going to look about how to make this thing a reality.
Sure.
But I will take you through the app, because
all right.
And so in regards to the app, you asked a couple questions that you sent over to me in the email, and I would appreciate if you just kind of ask me the question if you can, so that I can kind of make sure that they all get addressed. Would you be able to do that?
Okay. Give me okay, a minute. I'll do that shortly.
Okay, well, while you work on that, I'll take your audience to the app. So this app here is I'll read it right here. It says, "Kickstart your fitness journey." Like we said, you need a fitness foundation with the AFIA Online Institute. We have the combination of nutrition and exercises available all in one place. So what you're going to be able to do is with this app is you're going to, first of all, get personalized workouts and a meal plan that's tailored to your fitness goals. So the minute you sign up, the first thing we're doing is we're talking, we're communicating. We're talking about your fitness goals. We're talking about what it is that you look to do and achieve. And we're getting your blood pressure. We're getting your sugar, your sugar results. We're taking a look at all of the things that you need to do. It's almost like a checkup. It's almost like a tune-up, where you're going to maybe even be asked questions that you've never even thought of in regards to your health. All right. So we have experts who are standing by. Now, this is an Afrocentric platform just for people of African descent. So you're going to step into a world where your trainers, your nutritionists, every specialist that you get introduced to are all from the country. Okay. And so that's very important for me. And for those who took part in our summit and those who watched it on YouTube, you'll see that we don't have any deficit of professionals from our community.
Very true.
There is not an area of wellness and health development in healthcare that our people are not present and performing at high levels of excellence, right? So that's, with that being the case, it's time for us to bring all of these professionals together and provide a platform and provide a portal for citizens around the world to have access to this incredible wealth of knowledge that we have in our community. So you get the personalized workout plans, all right? And so with these personalized workout plans, they're actually also going to be some generic workout plans that are going to be uploaded, videos that'll be uploaded from professionals all across the globe, right? And the reason why we decided that this was necessary is because one of your questions you asked me about COVID.
You're right.
And give me that question again.
Yeah. What I mean, what was the response of our community to AFIA during the pandemic?
Yes. Well, the pandemic is the reason why the reason why this AFIA Online Institute exists. It was because I have so many friends in the space, in the healthcare space, whose livelihoods were affected and impacted because gyms were shut down. People were terrified to go into public settings, right?
True.
I mean, there was so many different things in place that they weren't able to navigate, and they weren't able to provide the level of service that their clients expect from them. And so they lost work. I mean, they lost work. And the truth is, a lot of those clients still wanted to work out, and they still found alternatives. And a lot of those alternatives were people of other ethnicities. That's because they start doing workouts in the park, right? They were ready they had an online solution already in place. Right. So they already were there. They were there already. So when the industry shifted to online, they already had the technology at their fingertips that they were able to adapt quickly. And so we were not, because we rely on other people's gyms, we rely on other people's technologies in contacts and networks, and we didn't take time to build our own.
Right.
So what I'm saying is that COVID-19 is the reason why we had to launch this, because now every single healthcare professional who wants to offer, who first of all wants to offer their clients a instant and online solution and access to their expertise, they can do it through the app. So these workouts that are uploaded and these training modules that are uploaded are from professionals all across the globe, right? And so what's really great is that now you get access to all these different people who are providing the same service but a different style. You know, everybody makes fufu, right? But some people make it different.
You're right.
Right. So we're putting, you know, all of these options on the table so that you can be exposed to all the different professionals in that space. The next is, not only do we show you through the app and through the website, not only through that, but we show you a collection of healthy food options in your community.
All right, that's great.
Okay, and the chefs from these restaurants are actually doing cooking shows on the app. So it's not just an app that you use when you're at the gym or you're at home working out. It's something that you can bring into the kitchen as well and get step-by-step information on how to produce these meals. Right? We have instant video calls, which means you can set up appointments with a trainer or with a chef, and you can instantly speak to them through instant messenger right through the app. And you can schedule it, and it's part of the plan that you get video calls, instant video calls, right? And there's accountability, right? So we know when you're not working out, right? We know when you are working out, and we get to help you gauge the results and the progress. So we're with you every step of the way. We're not here to just get you to upload the app and start using and not use it. We're here to make sure that you turn the app into, you know, as a tool on this pathway to health prosperity. And it connects to all your wearable devices, so your Apple phones and everything else. It's all connected, so it gauges your workouts, and it gauges, of course, it gets data, real-time data from you on your heart rates and things like that. So that is really where we stand. I know you had a couple other questions, so why don't you ask me those other questions?
All right, I do think you've actually answered all the other questions. You talked about AFIA and what AFIA is, what it means. So that's one of the questions, and then you did answer it. Yeah, you just talked about the main thing right now, how AFIA has helped our community during this during the pandemic. So the last question is, how can people engage the services of AFIA, which is this app? Probably you just want to spend 1 or 2 minutes. Now, people go to download this app. When will this app? I don't have an Android service. I use iOS. So when is it going to be ready on iOS and stuff like that? Those are the things that probably you need to tell us right now.
Yes, sir. Well, I'll tell you what, the website is available.
Okay.
You definitely always go to the website, and I'll be happy to share the link with you. But also, so that's for those who are not, who are not Android savvy, are capable. Don't worry, the iPhone app is coming, and I'll make sure that you're the first to download it. All right.
Awesome.
As soon as it's ready, I'm gonna call you. Make sure you're the first to download it.
Awesome.
But what we want them to do right now is we want them to go to the Play Store, go to the Android Play Store, type in the Afia Online Institute, and download it. Like I said, all those downloads is going to generate a donation from us, and you and I are going to figure out where that donation goes. For the month of February.
Awesome. All right. Thank you so much, brother. This is we are so honored to have you here tonight. Thank you so much. Your presence has added a lot of color to this event. And this is great. This is awesome. I'm so proud of this app. I'm going to talk about it. And yeah, go ahead, please.
No, it's very exciting, and like I said, it's a great honor to be able to launch it here on this global platform with you on this very special day. I know you got congratulatory letters from all levels of government. So this is not an ordinary moment, brother.
Now let me say.
I'm so grateful to be able to
thank you
this historical moment to this monumental event. So
thank you very much. We're sending them a copy of the sessions you've had. They're gonna have it. One person that I would have loved so much to be here is the Lieutenant Governor of Ontario, who will have graced this occasion with her presence. But I don't know why she pulled that last minute. The mayor never promised to come, and the premier never promised to come, but they just gave us their congratulatory messages, and we are going to send this across to them. It's being recorded. We're going to send this across to them.
My brother, you have the sixth mayor here, so hopefully I'll be happy to stand instead in respect for all those elected officials. I may not be elected, but I'm definitely respected.
You respect, yeah, you are. So we're glad to have you. Thank you very, very much.
And so I leave you. I leave you with Afia. I wish you Afia. Great
Afia. That exactly the way it is. I mean, it's just the way to say it. my peace. I live with you. Thank you very much. Afia, thank you very much. Thank you so much. All right, that's it. It's been a wonderful session there. Thank you so much to for gracing this occasion tonight. And that is Brother Dewitt Lee. You've heard from him talk about Afia, and like I said, this is recorded, so we're going to put it on our website as well, on our YouTube, and I think it should be on our website. We'll find a way around that. And then what you are going to see next is going to blow your mind. Okay, so that was all right. Okay, great. The link for the download of the app is just been sent. And on the app, like you said, you're going to find a whole lot going on there. It's going to be a live app where you're going to have chefs who are cooking real time, and then they're going to post their cookings and all of that there. You're going to see trainers who could take you through training sessions. You will see all of those. You see foods. You talk about health. Just like you said, the triangle that you talk about, I totally agree with that. The foundation of all of these things we're talking about is health. And then if you actually gone through any of our sessions, you understand that is the first thing I say. I talk about that. Once your health is gone, everything is lost. The only people who have the right to be on this side of eternity are the people who have a body. If your body is healthy and you are here, you're good. If not, you aren't good. Okay. So now, quickly, I'm going to show you something that's going to blow your mind right now. Somewhere in the city, somewhere in Nigeria is where this is happening. And then this is courtesy of BBC Pidgin Services. I really worked towards bringing this lady here tonight, but I can assure you that she's going to be on one of our programs very, very soon. Very, very soon, we'll be engaging her. And what has she done? I'm just going to show you real quick. So I'm going to share my screen, and you're going to see these beautiful, wonderful thing from our community. And this is one of the things I'm talking about. We cannot afford to be reactionary. We just have to, do what we have to do.
Stand in front of your mirror.
Listen.
You know, examine yourself, touch your breast, everything. But women know they do this thing again. For 2020 alone, according to World Health Organization, over 600,000 women died of this breast cancer. My name is Nabodariwa Kemisola. I'm a robotics and embedded system engineer. I invent smart bra device that detects earlier stage breast cancer. Wetin make me do the breast cancer device be say, for July 2017, I lost my aunt to breast cancer. So to save other women from dying of breast cancer, so they can get cured in time, they will know in time that, okay, I don't get breast cancer, so they can visit the hospital. That's the reason why I invent the smart bra device. Wetin make the smart bra device where I do so special to say the technology where I use, they very, very different for the technology where they exist before. So with this one, I know, you don't need to go hospital, go to do mammogram again. For your house like this, they do the test to get your readings. And the technology where we use is very safe. You know, get side effects. Now what they call those things nanotechnology, small the electronics like this, we call sensor. You know, go damage your tissue. The bra na device, so I have to emphasize on that. Now device, no be daily bra where you they use from morning till night. Now to just wear and take your reading for 3-5 minutes, come up time. So because some people go they think now say, if I use this, I don't go they wash them. No worry, you go there water resistant. What we say, you go use something to cover them. What we say, you just carry wet clothes cleaner. We start today do the smart bra devices 2021, and the prototype they work. Now the stage where we do that, and we don't do the patent registration. After the prototype now, we go carry out clinical trial, where we say we go to all regulators, then we go carry the bra, go meet them. So they go bring women, okay, come and try this thing, let's see. I don't place my hand on top the sensor now. See, we'll see that the wave change. So now like that, the thing will work if you wear them. So when it detects something, this information will go your doctor. So your doctor will be able to know to decode this information. If they wear, if every woman they wear this thing, death go reduce, the pain go reduce. As women they die, go reduce by 60% all over the world.
Wow. Thank you. I hope you saw that. That is from a Black person. Now, this is the statistics which you didn't talk about. In the case of breast cancer, it is noted that out of every 5 cases of breast cancer, 4 will happen among women of color, Black women. Out of every 5 cases of breast cancer, 4 would occur among women of color, Black people. And I've said this times that number. The reason it's not far-fetched is just because it affects people of color. Sometimes there is not enough funding going into this to make preparation and make funding accessible for cure, for solutions, and for help. All right. And out of every 5 women of color, now the cases are becoming more like 1 out of 5 that will come down with breast cancer have a lump. And then that is why the awareness is being increased every day. Check your lumps and all of that. So for her to come up with a bra, a device, that is not a fashion bra, that is just a device that if it is worn into the body of any woman, the breast, if there is a breast cancer, a lump that is starting up, it can easily be detected. And that is just what she has done. She's won several awards back in Nigeria. And right now, we hope that this will be pushed to a global level where this research is going to be funded. Afia, Brother Dewitt talked about sickle cell. Sickle cell is also likely a condition common among people of color, among Black people. There are many of them. Sickle cell is one of them. And it's one of the reasons why it seems like sickle cell is not getting enough research, it's not getting enough cure. It's because of the people who are the population that suffer from it the most. And so part of being proactive for us is to gather around our community to find solution to our problems. Because people from outside our community will not come and give us solution. when the vaccines for COVID-19 came, it is after they have used the ones they want to use, then they send the leftover back down to Africa. They are still sending to them anyway. Meanwhile, the one that Africa did was condemned right and there, and that's just the end of it. I don't want to talk about that right now. I've said I'm talking about that in some days to come. On this note, we're going to draw the curtain for tonight. I want to thank you all for taking time out to come and join us tonight. Now, the lady who is to talk about the ointment is not able to attend tonight. Last minute, she had to cancel. And I understand that, but we're going to bring her up some other time, and then we're going to treat seriously this issue of the ointment. I give you my word, and I promise you that is going to happen. But I want to believe that your time spent tonight has not been a wasted one. I want to thank you for being part of it, and then you can download the Afia app. It is free for everybody who participated tonight. Everybody can actually download it. Thank you, Mr. Solomon, for joining us. Thank you, Tanil Gregory. I like the fact that you always join. Thank you so much. Mrs. Agogo, thank you. You kept vigil. You should be sleeping right now. Thank you for joining us, all from the UK. People not from Nigeria. People from Nigeria are sleeping right now. Thank you, everybody. We really appreciate you staying up late tonight to attend this first ever Black History, Natural Health and Healing. So when we're talking about the history of this meeting, we are going to mention all of you that participated and those who are watching on other devices, other streaming platforms. Thank you so much. Have a good evening. Bye-bye.